Good morning, everyone, and welcome to you again for this, our final Professors of Faith, Faith Formation class. We started with Dr. Jeff Popiak and are finishing with Dr. Amy Luckowski, both who are singers in our Tabernacle Choir and are known well and are parts of some multi-generational Grovers. Before we get into the introduction to Amy and let her take over the class, let me just remind you of a few things. We are recording, so we're not going to be mentioning your names. If you have a question for us, just put that into the chat feature. If you are tuned in with more than one person, let us know that. Again, we are trying to take attendance, and that's worked very well. Just let us know. You don't have to let us know names, just how many people are with you. And I'll open with a prayer, and we'll get started. Jesus, thank you for welcoming us into your Father's house, this house of prayer, which is also a house of worship, a house of learning, a house where service begins. Thank you. May your Spirit be present today. Fill each of us, but especially Amy, with the things that you need us to hear. Thank you for her witness. We ask all this in Jesus' name, amen. So many of you already know Amy, because not only is she here, but her mother is a member of the church, and she and her husband Mark raised their children here. Amy was married at Grove. Obviously, she has two children. She's run some of our blood drives and our health programs and does the flu shots here. She's like Jeff. She went with the youth choir, only she served as a nurse. She's been at Camp Anaba. Obviously, she is a nurse and a professor. She developed and teaches a class on faith and nursing. So we'll want to hear a little bit about that. And of course, she's done some medical mission trips that some of you have been on through the years. And I think that's enough of an introduction. I'm just glad Amy is here. Thank you, Amy. And I'm passing the baton to you for the rest of the morning.
Okay, thank you. I hope that this is informational, not just about me, but about things that you can do in your career that also relate to your faith. Gary asked what all the initials are after my name, and we were just talking about how in nursing we like initials. So I have a Ph.D. in nursing. RN, of course, is registered nurse that we have to take a big test for and pass before we can practice. And CCRN means I'm certified in critical care nursing. And the CNE is my most recent credential. It means that I'm certified as a nurse educator. So we take big tests and pass them and pay money every couple years to be recertified. So right now I'm an assistant professor of nursing at Newman University. And I'll just tell you a little bit about my background at Grove. Pastor Gary mentioned my mom. She is a longtime member of Grove as well. She grew up in the church. In fact, my grandparents are buried at the very back of the cemetery. The Otters, it was her maiden name. So mom grew up in the church and sang in the choir for many, many years. And then I sang in the cherub choir when we had white little robes with red bow ties. And, and I sang in the folk choir when I was younger. And then I sang in the tabernacle choir in high school. However, my mother had to get special permission from Craig Ryder in order for me to be allowed to sing in the tabernacle choir as a teenager. So I did that. And then, of course, when I got to be a nurse, it was very difficult to continue to be as active in the choir because I worked every other weekend. When I was in college, I was on the staff parish committee for a while. Mark, my husband, Mark, and I got married in 1989 at Grove. And part of what we did as a young married couple was that we helped coordinate and recruit people to donate blood throughout the church. That has since, I've done that for many years, but in the last few years, it's been pretty unsuccessful. We haven't recruited enough people to donate blood, so we've kind of stopped doing that. Currently, I'm the Health and Welfare Committee of one, pretty much, and I just jump in and do whatever I can do when it works for me and the church. I've done blood pressure screenings at different events. I've taught CPR because I am a CPR instructor. We've ran a suicide QPR training, opioid awareness information, and then my medical mission trip to Solid Rock International, they came and presented about that organization. And as Gary mentioned, the flu shots have been pretty popular, so I try to get that coordinated every about September or so. So we'll see how it goes this year though. And then I actually was the youth choir tour nurse for 7 years. My daughter was in the youth choir from 7th grade to 12th grade, and I ended up doing a year or two after she graduated. And then I'm currently in the Tabernacle Choir. So I want to tell you a little bit too about, I guess I should share my love story somewhat about Mark. Mark and I met when my mom's friend, Jerry Cometa, her married name is Test now. My mom's friend asked my mother if I would be interested in helping a student in high school who was blind. And I was a first year in nursing school at Westchester University. And I said, oh, that sounds kind of like an interesting job. I was working as a nursing assistant. So I helped Mark in high school, helped reading to him, taking tests, preparing for class. And that's how it all started. And then we both got out of college and got married in '89, and we've been married 31 years at this point. So that's our story. Mark says I kept it professional for a couple weeks, 6 weeks, I think is what he says to me. Yeah. So here's just some fun pictures I was looking for the youth choir. This is the kids when my daughter was in the choir. She's kind of up at the top next to one of the twins there on the left with kind of reddish hair. And this is one of my favorite pictures because the three boys in the middle were the cutest things ever. And I remember all the old ladies as we went to choir tour, they just died with these three cute boys in the front. They just thought they were so good and so fun. And then my daughter's on the other youth choir picture down here at the bottom on the right-hand side. And that's Brittany Davis next to her. So I thought pictures would be fun to explain. And so here's a picture of Mark with his older seeing eye dog, Sparky, on the left. And then our new dog is Paz. He, unfortunately, we had to let Sparky go this week. It was a painful thing. He worked for Mark for about 10 years, and he was almost 14, or 12 years, and he was almost 14 when we had to put him down. And then Paz is on the left, or on the right, I'm sorry. Paz is P-A-Z, and it means solid gold in Hebrew. He's a golden retriever. So he and Mark travel to their job every day in Coatesville and help mentally ill people in a psychiatric day program. So he's quite good at what he does, and he's pretty cute too. Just sheds a lot of hair. And then I thought it'd be fun to show you some family pictures. We love cats. If you can kind of see on the picture there, we've got lots of cats. My son's there in the middle. I guess I'm starting from the left. He's in the middle holding a cat, and then his girlfriend's in front of him. And then the boyfriend's the tall guy with the glasses, the dark hair, and then Alyssa's down there. So Ryan and Alyssa are my kids, but now I feel like I have 4 kids. More kids. I keep getting kids. I don't know what happened. I thought I was going to have an empty nest, but I have more kids. So for my thought about nursing is, even when I was new at nursing, I really felt that it not just doing a task and taking care of somebody, doing their assessment, doing their vital signs. It was more than that. And it's to heal their mind, body, and soul, but listening to the family, caring for them. They might not remember who I was at the time, but maybe I made them feel something. And, you know, when I worked in the ICU, particularly, people would say, how can you do that all the time? How can you help people who are so sick? And I just felt that if I could make a small difference in their care, in their comfort, in the family's comfort, then that was why I was there at the time. Even if they were going to pass away, I was there to help them ease that transition. So that has been my thought about nursing, that it's more than just doing things, it's caring for people, even just the little things like washing their hair or holding their hand, I think makes a big difference. So back to my career, just so you kind of have a background about that. I graduated from Westchester University with a Bachelor of Science in Nursing. And at that time in 1988, there was still a lot of nursing schools around. In fact, my mother is a nurse as well, and she went to Lankenau Hospital School of Nursing, but was working on her Bachelor of Science in Nursing at the time at Immaculata, and she pushed me to go to college in the first place, which was a good thing. Nurses need to be educated well. So I started my career at Chester County Hospital, CCH, and have never left all these years because it's been a good place, and I've grown alongside with it. I worked in a medical surgical unit at first, and then I worked in post-anesthesia care, which is recovery room. And then I worked in the ICU for about 5 years, and then I became the critical care educator. So I was responsible for educating the nurses and ancillary staff for the intensive care unit and the telemetry unit. So all about heart rhythms and critical care and ventilators and hemodynamic monitoring and all kinds of stuff like that. And I did that for 10 years. And during that time period, I also got my master's from Westchester, and it was a nursing education track, which was important because I was learning how to be a nurse educator. Nurses just don't automatically teach well, so I needed to learn that. But I did a parish nurse practicum as part of my community experience, and I was paired with a woman named Linda Clay, and she had responsibility for several churches in the area. One was a very kind of, I don't know, maybe a little alternative church, and mostly a white congregation, but she also was responsible for 2 Black congregations. And it was very eye-opening for me to learn about the different types of worship, in addition to the diversity of the people that we worked with and what her role was. Then I had 1 year, I don't even have it on here, I worked 1 year as a director of nursing, and it was horrible, painful, and I will never do that again. And I decided I need to go back to education. So I got to be a professor at Widener University, and they have a PhD program there. So I was able to enroll in their PhD program and not have to pay for it. So that was awesome. Not very easy at all. My own personal stress test for sure, especially because the kids were 2 and 5 when I started back with my master's, and then older when I was working on my PhD. So I have lots of, on my CV, I have lots of presentations. We have to do that as a professor, lots of presentations locally and international, or not internationally, nationally, I should say. And I've written a fair amount of articles, mostly on critical care type of topics like heart dysrhythmias, but then also I've written about things to help nurse educators be better educators. And I decided after 9 years at Widener, with the growth of the programs and just how big the university is, it was a better fit for me at Newman. The nursing program is smaller, more important, and they have a different kind of perspective on nursing students, and just the whole experience of being a professor is very different. In fact, when I interviewed with the president of the university, in fact, who was a nursing faculty back in the past. And I also interviewed with a very nice sister, Marguerite, who talked about the purpose of Newman and the Franciscan values, which are very Christian values. And even though I'm not Catholic, it still resonated with me. And it's interesting though, because we have faculty meetings, and there's always a prayer before each faculty meeting. And everybody's crossing themselves, and that's not something we do as Methodists, but you know, it still fits in with what I do. And I have to tell you, it was really kind of funny when I'm giving an exam at Newman, and a lot of times the students have a person they're appointed to be like the chaplain of the class. So they want to say a prayer before the test. And all I can think of is they're going, please God, please have Dr. Luckowski give us easy questions. You know, like, amen. I'm like, okay. But that's kind of cool how they do that. And I've continued to work as a nurse since I've been an educator, because I think it's important as a professor to be in the field as well. And I work in the post-anesthesia care unit at Chester County Hospital throughout my whole time as a professor. And I'm working quite a lot at Chester County Hospital since they started doing elective surgeries again. There was a lull there for a little while, which was good because I was going a little crazy trying to convert to all online and learn those programs. Especially we were trying to do clinical and we had to do simulations and purchase the program and learn the program and do simulations and then do a lot of online meetings. And sitting at your computer all day is tough. So anyway, so I've been working a lot this summer in the post-anesthesia care unit. They do test for COVID, but we still have to wear masks during our whole shift. And if somebody has a suspicion of COVID, or they've been in a long-term care facility or some sort of living where there's a lot of people, then we also have to do the whole garb, the really hard mask that goes around your face and, you know, dressed all the way down. So I have a little bit of experience with that. Luckily, most of the time it's just the mask that we have to wear. And then I also work and teach in the online nursing education program at Wilkes University. A friend of mine got me a job there, and it's fun because I get to share both my nursing education experience in the hospital, educating from physicians, nurses, techs on, you know, all different levels, to my experience teaching undergraduates. I teach two main courses. I teach community health nursing, and I coordinate that, and I do the clinical experiences for my students. I take them into the schools in Delaware County, and that has been eye-opening too, some of the experiences that the students have had with drug and alcohol issues and suicide and very, very poor families and how they handle things. And then I also teach in the acute care medical surgical course, and I've done clinicals doing that as well. So as you can see, I like to stay busy. It's hard for me to sit still. I have that problem. My mother, if she's listening, and if she got on, she'll say, take some time for yourself. But that's just kind of how I like to do things anyway. So Gary mentioned that I have a faith-based nursing class, and it was cool because at Newman, the dean had asked me, hey, we need an elective, a nursing elective. Was there something that you would like to do? And I thought, oh, this is cool. I need to develop this course. So I kind of made it up, actually. And I start off with talking about how God has given us different gifts for doing things. And if your gift is to serve others, you need to serve them well. And I talk about my own personal beliefs, and I emphasize that they don't have to be regular churchgoers. They don't have to have time right now to deal with that, to go to church every day, every Sunday. But they have to have that Christian attitude toward caring for patients. So they need to think about how faith and health are integrated together, define how a nurse would function in a faith-based setting, like the old term is parish nursing, but it's faith-based nursing is the newer term. So it's not necessarily a Catholic, parish implies Catholic, I think. But it's how nurses can function in a church setting. And then one of their main assignment is that they have to figure out and implement and evaluate a health-related activity in a faith-based nursing community. So they can do like a blood drive, a health fair. I've had students do something on campus because the campus has an active church service every Sunday, and then they have things for the students throughout the year. So they had I had students do like a little health fair where they talked about flu shots and washing hands and doing stress management, things like that. So this faith-based nursing class I run it every fall, and I've run it twice now. And of course, after the first time, you always improve things, but it's been interesting trying to help students learn how to care for people, because that's one thing that I don't know that you can teach that so much, but at least we can talk about different ways to care for our patients, our families, our friends, and how, like I said in the beginning, it's not just about learning how to put an IV in or doing vital signs on a patient. It's talking to the patient and learning about them and talking to them so that they're calm and relaxed and they're not scared, because everybody's scared when they're a patient. And trying to talk about my experiences as a nurse and maybe hear some of their experiences if they've been working in the hospital, about how they can integrate their faith into their care of patients. So that was kind of what my thought was about developing this class. Should I stop and ask for questions now, Gary? Or?
You can. I'm looking to see if there are any questions, but Pastor Lynn says no, not yet. So
okay, well, good.
Oh, no, wait, we do have one question. Hold on.
Uh-oh. Probably my mother.
Say that again. How has COVID impacted the classes and all that you've done before?
Yeah, that's a good question. So at my university, when COVID came, we went to all online, and we, as professors, we had a few days, really. We had like these long, horrible meetings on Zoom to learn how to put everything online. So we just translated our lectures and were able to put it online, and then synchronously we would teach our class. So if my class was at 12:40 on Wednesdays, then at 12:40 on Wednesdays, I would tune in and have my PowerPoint and other things loaded up, and then I could see the students and interact with them and share the lecture. It was hard though, because I'm used to seeing people in the classroom, and Gary, I'm sure you can relate to this. You're talking, but you're talking to a computer and you can't see people's expressions. And you ask a question and you're just like, you kind of have to make yourself wait and kind of count down, because you don't see somebody about to answer a question, right? Or somebody saying, oh, okay, yeah, I want to talk. You don't see that unless you're happy to see some screenshots pop up, but you don't ever see everybody in the class. So that's been interesting. And then my other challenge is when people are writing comments and you're talking about something, like, oh, okay, well, Andy asked this question, okay, and then you answer it. You just kind of interrupts your flow a little bit, I guess, is the best way. So putting the lectures online was okay, just getting used to it. Our testing had to be online, and unfortunately, it's very expensive to have some kind of proctored testing program. So we actually gave tests without being proctored, which was a little bit worrisome. Not everybody is honest in doing that. So that is worrisome, because in nursing, they have to pass the NCLEX, and it reflects on the school if they don't pass it the first time. So there was that issue. And then the clinical experiences, we had to do simulations, and they did case studies for medical surgical nursing, but for my community nursing class, we had these simulation, which were really good. They were about things that normally you wouldn't see, such as it was a bus and a train accident. And it was almost like they were avatars in like a video game, really. And it showed you different patients, and you hovered over them with your mouse, and it told you about the patient and what happened to them and what their injuries were. And then you had to rate, it was a triage. You had to rate them on a different color cards as to whether they were, how sick they were and who needed to be seen first. So the students enjoyed that, but it was a lot of doing a pre-conference at a certain time, having them do the simulations, doing a post-conference, lots of reading, lots of sharing things online, learning new programs, typing everything up. It was a lot of work for those, probably the first month until we got used to the program. And then my coworker had her baby April 15th or so. So that was a problem too. It was all kind of last minute. So COVID's really going to impact us, especially for the fall. Every minute we turn around, something's different. The latest was that, this was just Friday, that if your class is over 31, you have to be fully online. And if you're under 31, then you have to be on campus unless you had some kind of reason not to be on campus. And so originally I was going to be the only one there of my 2 classes, but now I'm going to be teaching online in addition. And we're hoping that we get into the hospitals and have our clinical experiences there, because nothing is better than working with real people and talking with real people and doing things. Simulation has a place, but we still need to be in the hospital. So we're hoping that we continue to get to do that. And for my community health, we use the prison as a clinical option, and we also use the schools, excuse me, hospice and home care. So we're hoping to get into all those places. Of course, my mission trip, which I'm going to talk about soon, we were unable to do a mission trip this fall. In fact, my mission trip that I had in March, we just got back in time because we were in Dominican Republic in the hotel waiting to come home. And that was when President Trump announced about closing the country to anybody coming in. And I felt like we were just barely getting through and getting back in time. It was March 14th when we returned. So it really has impacted our educational system. At least the students tend to like the online better. You know, they don't have to get up and dressed. And but some of our students are older with kids, and that's been a challenge with them trying to present online, because they have to do some presentations themselves or listen online or get on at certain times. It's difficult. So it's a challenge for everybody at this point.
Thank you.
Yeah. All right. Ready for the next? Whoops, went too fast. Okay, so Gary mentioned that I've been volunteering at Camp Anaba for the past couple years. Actually, I was looking for something else to do in the summer after I had stopped being the nurse on the mission trip. You know, with all the minute clinics that they have out there, it didn't seem to be as necessary to have a nurse anymore on the trips. And, you know, I was ready to do something new. So Diana actually told me about Camp Anaba. I had known about it. I had never gone, but I had known about it. But I didn't realize that they needed nurses. So I started volunteering a week, and then you get recruited to do a little bit more than a week. And on Sundays, the campers check in. So nurses go through their medications with them and make sure that they have enough and they're properly labeled. And we have pictures of the campers. And at Camp Anaba, it's not just regular campers, but there's also the special needs campers, and they have certain weeks where they come. And some of these people have been going to Camp Anaba for 30 years. It's amazing. And that's their vacation, and they love it. So you have different intellectually impaired individuals, Down syndromes and some other issues. And there's campers with diabetes and heart disease and thyroid problems because they're in their 50s and 60s. So some of these campers, they have to be able to communicate, of course, and be able to walk around, because there's things to do like canoeing and, you know, walking and hiking and things like that. But it's been a fun experience. I get my own cabin, which is nice with some air conditioning. But I've said some interesting things. A lot of it's just being kind of like a mom and a little first aid and the Band-Aids and, you know, kiss the boo-boo kind of thing. But also I had a camper have a seizure, and we've had some allergic reactions and things like that. So I felt like it's been a good experience for anybody. So if anybody in the audience is a nurse or knows of any nurses that need a summer activity, if you have young kids, you get a discount if you send them to camp too. But also what was really fun is a lot of our Grovers go to Camp Anaba, some of our youth. So usually I would go the week that Diana was there with her night shift camp. And of course, what did they do but wake me up in the middle of the night just for fun, I think. Hey, Amy, can you help me with this? So that's been a good experience, and I'm glad that Grove is part of that organization. So I wanted to talk about my medical mission trip to the Dominican Republic. When I finished my PhD, you know, I wanted to do some more things that I hadn't had a chance to do. So I have a friend who had been leading medical mission trips to the Dominican Republic through Solid Rock International. Her good friend was a missionary there, a nurse. She's a nurse, and she actually spent about 8 years in the Dominican Republic. And I just wanted to show you where it is. You can see where we stay is pretty close to Haiti, the other half of the island. And I do like their mission statement of transforming the body, mind, and soul of the poor in the Dominican Republic. So I liked it so much, thought it would be a great experience, that I thought it would be cool to bring students. And that's the other thing I got to do at Newman that was so awesome, is that I was able to write up the mission trip as a course. And so it would fulfill the clinical hours in the community health nursing course that I teach. And, you know, of course, I had to jump through the hoops of the paperwork and get it approved by the vice president and all that good stuff. But luckily, Newman has a great support of an international travel person who is able to coordinate for me the application from the students, their passports, their money, all of that. And so she does that piece. And then my friend Kathy Case organizes the trip. So I kind of jump in and I'm the teacher. So it's not that I'm doing everything involved in doing this course. But the clinical hours, it's great for the students because it's a week and they get 6 weeks of credit. 2 days a week we do clinical. So they get their 2 days a week for all condensed into 1 week. They do have to pay extra for the course because, you know, they have to pay for their room and board and flight and all that good stuff. But students have really, really appreciated it, some because it's a week and then they have more time with their kids and their family during the semester and more time to study, but others just because it's a great experience. So last March was my 6th time taking students, and usually I take between 8 and 13 students at a time, so I'm over 50 students at this point. And some of them have never, ever been on an airplane before. Some of them have never, ever been out of the country. And then I have other students who've done mission trips before. So it's always interesting to see everybody's experiences. And I just want to put a plug in for Solid Rock because they do have a really high rating as a charity. They don't have, they don't spend a lot of money to pay their president or the coordinator of the organization. And I feel good about supporting them with myself and the students. So where we go is the Christian Clinic, Solid Rock International. This picture there looks pretty scary because you see the wall there with the wire at the top. The reason for that is because there is medications on site. So, and that's kind of just how they keep safe. It's in San Juan de la Maguana. In Dominican Republic, so it is a town. There's also a school close by that Solid Rock sponsors, but inside looks a lot prettier. They have a nice guest house there and good accommodations, and they take good care of us and we are safe, and they feed us really well too. So there's a couple pictures next. On the left is my first group of students who went. Long time ago now, 2017. But what they're doing in classroom is that we are popping pills out of those paper there and putting them into plastic bags because we buy medications. Part of what our cost of going on the trip is the medications that we give to the patients when we're there. And so we have to take them out of those containers and put them in bags so it's easier to transport and dispense to people as we go around to the little towns. And then on the right-hand side, I try to find one of Penny. So Penny is working there on some medications. Penny and Jackie went with me on the trip from Grove. And also you will see Faith Pickering went on the trip from Grove. So when we go, our main job there is to do the clinics, go out to the little towns, the little villages. We start at San Juan and we get on the bus and we go out to these villages, and then we set up clinics when we're there. So they look for a church building, a school building, something that we can go set up. into. And you can, the picture here on the left is just trying to show you, like, there's chairs lined up for the people who are waiting to see us. And then we're inside that building, and we have 3 areas. We have a triage area where we have the students and myself. Usually I do this job, is we take vital signs and get a little medical history, and we have one tiny little piece of paper to write all this stuff down on. And then they go and see the provider, the doctor or nurse practitioner, and then they go into the pharmacy and get the medications if anything is ordered for them by the provider. So we have 3 little stations in these buildings. They're variable. They're usually pretty basic. No air conditioning, obviously, besides the wind, if we have wind, and you know, basic accommodations. And I just had to put, you know, the bathroom there on the right-hand side. So I do have to warn the students that our accommodations for bathrooms can be a little tricky, because it might just be a hole in the ground, or it might be somebody's home, and they rarely have running water. So we do bring our own food and water when we go to the villages, but it's pretty basic. And a lot of people are shocked by that, but I guess they've never gone to camp and peed in an outhouse, I guess. I don't know. So here's the triage area. You can see my student there in the blue scrubs. She's talking to a patient, and then next to her is a Dominican translator. The organization hires Dominican people to help in all aspects of this mission. So Odo there is translating whatever the gentleman is telling him, and then you see my other student in the background as well. So we have 2 stations of asking patients their medical history, their medications, taking their vital signs, and if maybe taking their blood sugar if they need that done. So we kind of quick assessment of them. And then they go and see the physician. That gentleman there is Dr. Pena. He's a local physician that we hire a lot of times because he works well with our students. He's very good at teaching. He doesn't speak a lot of English, so there is a translator there as well. And we see all ages, from little babies all the way up to an 80-year-old gentleman who's still working in the fields and has back pain. Some of the diagnoses, a lot of pain issues, a lot of things related to unclean water like parasites. We have hypertension is huge in this population, and diabetes is huge. So we see a variety of issues, wound care sometimes as well. So we bring the medications, but we also started bringing eyeglasses, and I took a picture of this gentleman in March, because we were able to get him the eyeglasses, as we get older, we lose our vision and we have to have the cheaters. So these are just cheaters that help him be able to read something and see something better. And, I can get them at the dollar store for like, $1 or less sometimes. And it's amazing how much this can change somebody's life. And then you can see our pharmacy. Our pharmacy is a box, and our pharmacist there, Gary, who, very Christian man who is awesome to my students, teaches them all about medications, quizzes them. They have divided up the box and put different meds in different areas of the box, and then they take the prescription and then they fill the prescription. Then my students do that, and then Gary checks them and makes sure that they're correct. And we put them in a paper bag, label it with the patient's name, and then a Dominican person gives the instructions to the patient or family about the meds. So it looks kind of chaotic, but it's pretty well organized. And then part of my course is the students need to do some health teaching. So a couple things that we've done is you can see on the left that there's, it's actually talking about breast self-examinations and explaining it. And even the gentleman there was very interested in learning about this. One of the students ended up teaching about the Heimlich Maneuver because somebody had told them they had a family member die from choking on a piece of meat and they couldn't do anything about it. So sometimes they do a lot of health teaching without even, planning ahead. They do a lot about hypertension and how to eat better. And then we also did some teeth care down there, how to floss and how to brush your teeth the best way. So lots of different types of health teaching we try to do. And then another cool part of our experience, so the students do triage, they sit with a provider, and they do pharmacy, but then they also get to go with Pastor Anol, who's part of Solid Rock, and that's him. He looks like Don Cheadle, I think everybody says, But they get to go with him out into the people's homes and see where people are living and how they are living and how happy they are without the latest iPhone or whatever we like around here. But you get to see the issues, take their blood pressure, talk with them, and Pastor Noel will pray with them and talk about faith. And the students have been asked to share their own personal faith journey. Sometimes that makes them uncomfortable, but sometimes they really enjoy praying with people and getting to know them a little better. And I really think they learned that you don't need too much to survive in this life. You know, they come home and appreciate things like we take for granted, like a hot shower and good food and safe water, clean and safe water, and how you can be happy with little to nothing. So that's just a couple pictures showing you about where people are living. The bathroom that we might use, they don't have good infrastructure in Dominican Republic, so a lot of the trash just goes on the side of the road. It's gorgeous. It's a gorgeous country, but they don't have any other place to put trash. And then kind of a fire inside to cook their meals inside one of the shacks without any kind of protection from the elements. It's just some things that we have learned and seen. And then we decided to sponsor a child when we're there. Girls don't have the advantages as boys do. So my first group of nursing students sponsored Denise. They picked her out and they sponsor her so she can go to school. And every semester, then the next group of students contribute toward the sponsorship of Denise. And we have continued to see this little girl, and we bring her some presents and some, she likes nail polish and perfume and drawing things. And her mother's in the picture as well. And she has some siblings. So we all try to bring her some things and visit her while we're there. So that's been cool to see her each semester. And then in the fall, we're able to do surgeries. We bring a surgeon with us and an anesthesiologist and a surgical team. And we're able to do the surgeries in the clinic there. This is the preoperative area. And you see all the patients laying and waiting to have surgery, and they come in first thing in the morning and they don't complain. They wait quietly. They're very thankful that we're there. And we do such things as hernia repairs. We do take a lot of, and we bring a general surgeon. So it depends upon what kind of surgery that we can do. But we've done taking a gallbladder out, laparoscopic cholecystectomy it's called. We've done thyroid surgeries. We've done taking tumors off. So a variety of things, circumcisions too. That's not something they typically do in Dominican Republic. So it's an elective surgery. So they wait here in pre-op, real basic. Mom will remember these beds that you have to crank at the bottom of it to get the head of bed to go up. So very basic donated materials, picture of our operating room, picture of our surgeon there getting his gown on, and you kind of see a student here, kind of blurry, but you can see a student there helping the anesthesia person. So my students really get to see the whole operating room experience from pre-op, inter-op, and post-op, and they're able to follow the patient, and our surgeon and anesthesiologists really talk about things and teach my students more so than it would ever happen in the States. And there's our post-anesthesia care unit, my PACU, so that's where I end up helping out when I'm there. We're doing surgery, so again, just real basic kind of room. We have supplies at the end, fans for those of us who get a little hot, but we have monitors, we have oxygen, we have suction, everything's very basic, just screens on the windows, and but we have the right supplies for the patients. We're able to take good care of them, and the same thing. And I had to include a picture of me holding the babies, because that is the most fun part for me, is I get to talk to the kids and hold the babies and, you know, have fun doing the job. And then we discharge patients right from this PACU. And I tell the story, one of the first times I went was that, you know, normally when we discharge a patient from the hospital, we just kind of get them all together, give them the instructions, put them in the wheelchair and take them out to the car and they go home. Well, I had a gentleman who had bilateral, so both hernias repaired, and they were groin hernias, and he was going to go home. He was like 70 some years old, and I was talking to his daughter, who spoke very well English, understood what I was saying, and I realized that their transportation home was him on the back of a motorcycle for an hour. So I really didn't think that was going to work because he was not real awake. I mean, he was awake, but he wasn't like, you know, himself yet, right? It takes a while to recover after general anesthesia. So we talked about that, and she was able to get a taxi for him, which is this old broken down car. He was in the taxi and she drove behind on the motorcycle, and they got home that way. So kind of, it really emphasized to me how different everything is, and how
we're drawing to a close. I
okay.
don't want to cut you off, but
no, it's okay.
Lynn and I have to be at worship in a few moments. So
I
if
know,
you
I'm
could
sorry, I didn't.
wrap up
I'm
over the
just
next
talking.
30, 60 seconds. And,
okay, so if you see this picture, there's Faith in this picture, Jackie, there's me and Alyssa. Alyssa has been going on the trip with me for several years, and you don't have to be medical to go on the trip. They're building a new hospital right now to accommodate more of, and they're gonna have an ER and ICU and labor and delivery and everything there. So I want to invite anybody in the congregation to come on a trip. Hopefully we'll get to go again. And I also want to say that I hope that everybody is well and that you may be in good health in this time, and it all goes well with your soul.
Thank you so much. Fascinating work. Great testimony. Wonderful to see how your faith has truly impacted your life, your vocation, your ministry. Thrilling. And I thank you for inviting folks from Grove to go again in the future. So that's it. Let me just remind folks that next week we will continue. We'll be starting a new series on racism. I think Deacon Diana is going to lead off next week, and then different members of staff will take different weeks. I know I'm scheduled for one of them, and thank you again. Thank you, Amy, and God bless all of you. Have a good week and stay cool and healthy.
Stay healthy.
God bless. Bye-bye.